We are also joined by Ms. Khabar Mumtaz, who is the former chairperson of National Commission on the Status of Women. She has been engaged with different aspects of women's rights since almost 4 decades, and she has written and published on women's rights and women's movement. We also have Dr. Aisha Tareen, who is a clinical psychologist at the Special Education and Training Center in Lahore, which is a charity working with deprived children and young adults with intellectual disabilities. She's also the director of Palm Practice, which is a mental health consultancy in the UK, and she provides assessment and therapeutic services for children and families. We're also joined by Dr. Seema Pervez. She's a psychologist and former professor at the Quaid-e-Azam University, Islamabad. Her work focuses on the intersection of gender studies and media aspects. Dr. Sadia Bukhari is also joining us, who is the founder and director of Mohsinini Resource Center. She's a policy analyst and communication strategist and activist for women's rights. And we're also joined by Ms. Saman Essen, who's a program management consultant at UN Women. So now I hand over the session to Ms. Uzma Haroon to start the discussion. Thank you.
Good afternoon, everyone, and assalamu alaikum. I hope all of you are doing well in these difficult times. Thank you for joining us today to discuss this very important topic, how this pandemic is affecting women's life, both in terms of mental health and physical health, and also their livelihoods. So before we start the discussion, may I request our Executive Director, Dr. Abid Suleri, to give the welcoming remarks. He has to leave early, so I'm going to hand over the mic to him. Thank you, Abid.
Well, thank you very much, Uzma. Thank you very much, honorable panelists, especially my thanks to Rani Appa, who has joined us today, and also to Her Excellency Wendy Gilmore for being here. As Uzma mentioned in her intro, today's topic is extremely important and vital because when we talk of crisis, we need to understand that these crises they regressively and negatively affect the sections of society who are already vulnerable and who are already marginalized. And one of these sections, of course, is the women. We need to understand the impact of this COVID-19. It affects differently to women, not only in terms of the physical ailment and the physical impact of it, but also the emotional health and the mental health. And of course, in South Asian society, when I look at this lockdown context and when I look at families, of course, following rightly social distance and staying home, most of the time the burden of all the household hits on women, and especially women who has to then take care of all the household things and their official commitments too. But if we go further and we look at the government responses to it, and especially the response which government of Pakistan is providing through the cash transfer, there one can again see sort of the way of distribution, I would say, is not very impressive. Actually, at times I feel when I look at the TV reports and different clips which are being circulated on social media, that it is sort of disgrace to women. We already know that one precious life, when women actually was lost her life in a stampede in Multan on the second day of this distribution of money. So through this seminar, while you will be presenting all the recommendation, my request to the authorities would be, and when I say authorities, I'm talking to district administration. Of course, federal government and provincial governments, they announced the package, whatever they could, but now it's up to the district administration how respectfully they can distribute it. So my request to them would be to take special care of dignity and safety of all the women beneficiaries who are there. We need to make some arrangements whereby this distribution can be as smooth as possible. And I'm happy to note that there is also a psychologist on the panel. I think this whole impact of COVID and the lockdown on this psychological health, on mental health, that is very important, and that is perhaps one of the least discussed topic in at least in Pakistan's response context to COVID. So I'm grateful that she could join us. And as Uzma might have already mentioned, that this series of seminars, through this series of seminars, we are trying to learn from experts, and then we try to prepare a summary of recommendation and link it with the right kind of decision makers, where these recommendations they get noticed, and we try our level best that many of those recommendations they get approved, and some implementation happens to them. So I would request all the panelists, if you can give us some doable, practical suggestions, that would really helpful. And through this, we'll be able to bridge this policy research gap that chronically exists in Pakistan. I'm sorry I have to leave for another meeting, but I'll make sure to get the recording of the proceeding and to listen and get myself educated. Thank you very much, Uzma, for providing me the opportunity.
Thank you, Abid, for your welcoming remarks and setting the tone for today's webinar. I will now move to the first speaker of the session, the High Commissioner of Canada, Her Excellency Wendy Gilmore. Thank you for taking out time today for this webinar. We would like to set the international context, starting with you. If you can throw some light on how to make domestic violence reporting more effective during the quarantine, and what can we learn from interventions made in Canada? Another question is, how can the Canadian government support the government of Pakistan in these times? And further, how can men, women, and transgender be given sensitization and capacity building trainings during this lockdown in areas especially where is limited internet access? So we would like to hear from you, Wendy. Over to you. Thank you.
Thank you very much. Really my pleasure to be here. I think, I know, certainly my generation of policymakers, the whole concept of doing these web-based approaches when we're not in the same room with one another and learning how to manage the technology is, you know, we've been forced into it very quickly and are still learning as we go along. So it's actually a great opportunity, and love to see you all. So it's wonderful to have you on screen. I will. I mean, I'd love to get into the discussion. So I'll go through the questions that you've given me fairly quickly. The first is maybe a little bit about what's happening in Canada, because I find it very interesting to look, and a little bit disturbing to look at how the virus is progressing through the Western nations, Europe and North America in particular, as and then think about what is going to be different if we reach the same rates of infection and the same proportion of those infected in the developing world in countries like Pakistan. So in Canada right now, there is widespread community transmission of the virus. Well over, I think it was 25,000 cases or so, in the hundreds of deaths, primarily in our two most populous provinces, in Ontario and in Quebec. The virus is disproportionately impacting the elderly in our senior communities for the very negative outcomes, the more serious amounts of disease. So we're seeing widespread transmission in seniors' residences and in communities where there are a lot of people with immunocompromised or underlying health conditions. And that's maybe a little bit different in Canada than it is in a place like Pakistan, where we don't have the same degree of extended families and community or you know, numbers of generations under one roof. You tend to have seniors' residences where large numbers of seniors are living together, and that has created sort of very, very dangerous conditions for many people. And in particular, since there is a larger proportion of women that live longer in Canada and many other Western societies than men, we're going to prospectively be seeing more women being impacted by this disease. In serious cases, because I think at this point, what's very clear is that there are large numbers of people who are infected with this virus who may be asymptomatic or have a very mild case of the disease, and it's the seniors and immunocompromised and underlying health conditions where there are people that are most badly affected. The Canadian government has put in place a series of measures, and frankly, very luckily, we have the fiscal space to be able to do it. So that's also another critical difference between a country like Canada, where many complaints perhaps about how our economy is running, but the government has exercised a great deal of fiscal discipline over the years, and so there is budgetary space to take significant measures when a crisis like this hits. So there are programs that have been put in place to address the impact on individuals, on small businesses, on larger businesses, tax relief, a whole suite of different programs, including specific programs to address more vulnerable communities. And this is, as the practical suggestion that I would put out there, is that what Canada has been trying to do over the course of the last number of years, quite a while now, is ensure that public policy decisions take into account gender-based analysis, GBA. It's now, as a public servant, anytime I put the equivalent of a PC1 in the Pakistan context, but put a proposal to government for a decision, I am required to include an annex on the gender-based implications of whatever it is that's being recommended. And that means that there has to be specific consideration given to how public decisions, how new programs will impact women and men differently. The other genders, I mean, in Canada, we're required to do LGBTQ2 analysis, so taking into account the lesbian and gay community, transgender community, and others, on how these policies will impact. Will there be access to resources? Will the distribution be different between different genders? Will the benefits to the programs be differentiated by gender? And then that's taken consciously into account when decisions are being made. So one of the things in the establishment of the suite of social programs is that specifically in Canada, there was a recognition that the nature of this pandemic, and in particular, the requirement for isolation within community groups, within family groups, is a significant stressor on those communities that may also already be impacted by domestic violence, by family stressors of various sorts. And the result is that there's the programs that have been put in place to put resources into women's shelters, to put resources into lifelines that women and children in particular have access to when they are in a lockdown situation. Doesn't mean that it's perfect. It doesn't mean that the violence is not increasing significantly, or that there might be difficulties, or the access to services is not unduly constrained for women in particular. But at least as a start, there has been a conscious decision to take those elements into consideration. The other thing that I would put out there that I found both interesting on a global context, but also in a Pakistan context, is the fact that we're seeing the securitization of the crisis in particular. And I mean by that it's the security-based institutions, national security-based institutions, which are taking the forefront because of the sweeping nature of this crisis from a social and economic and security perspective, which of course means in many cases male-dominated decision-making. Even in a Canadian context, around the world, in Pakistan in particular, where you see significant security institutions and economic institutions, often they are very male-dominated, which means that women's voices and other genders are not taken into consideration when some of these decisions are being made. And so as a practical suggestion, I think that we can all globally, I mean, not necessarily for me to give particular advice to the Pakistan government, but to make sure that there is space for different perspectives at the table. That should be gender-based, it should be minority-based, religious, ethnicities, so that the communities that are being impacted have an opportunity to participate in the decision-making. And that has to be a very conscious decision, I think. It's not something which will happen by chance. I will not name names, but I was speaking to some decision makers in the Pakistan government over the course of the last few weeks. And one of the interesting things about how the virus is it manifests itself in Pakistan is that a very high proportion of the deaths that are being reported are male. About, as I understand at the moment, almost 70% of the deaths that are being recorded are of men. And to me, and from what I've been reading and people I speak to in a Pakistan context, I'm not entirely sure that that would be accurate. Does that reflect women's access to healthcare? Does it reflect the the reporting available for women's health needs and women's health services compared to that of men? Does it reflect that if there are choices to be made in families with limited resources, are the women being given equal access to healthcare as the men? So I think that that making sure that these, and specifically gender-based points of reference, both in information collection and then in decisions, is absolutely crucial in any crisis, but in particular in a health-based crisis like this one. I will stop there and then look forward to the discussion.
Thank you, Your Excellency, for sharing your thoughts and highlighting very important aspects of the issues. The questions are also being placed in the chat box on the right side of the screen. If we miss out on any of the questions, do please visit that chat box from time to time. So our next speaker is Ms. Khabar Mumtaz, joining us from Lahore. She has played an important role in women's rights and women's movement in Pakistan. I would like her to set the national context here. If you can share with us the overall impact of the pandemic and how it is impacting women's livelihoods and their rights in the context of Pakistan. Over to you, Ms. Mumtaz.
Thank you. Thank you, Uzma, and greetings to everybody on the panel and the audience. First of all, I think it's very timely that SDPI has taken up this issue, and I welcome it. You know, if we look at what any crisis, when it takes place, who gets affected most, in Pakistan, but in many other countries also, is the women who take the brunt of the impact of a crisis. Whether it's a natural disaster, we saw it in the earthquakes or the floods, women are the ones who are least prepared for a disaster. They do not, in the social hierarchy, they're not very important, neither is their decision always solicited. So the reflection of the impact is also the reflection of society at large. A society which is hierarchical, where women are not always the most important persons within a household, and their views also are not always taken on board. On the other hand, in this particular crisis, we see that women, where we look at the impact of women, I think it's probably much more multiplied, because most of the caregivers in the formal sector, nurses, midwives, they're all women, lady health workers. These are women who are accessing people in their homes, and they're the ones who are at the forefront of this battle against this virus and this infection. So they are the most vulnerable. And while other doctors, male doctors also are vulnerable, I think women are more, because there are many more in terms of numbers. Secondly, while I agree with Wendy, we're not sure what the figures are telling us. I don't think our data is still at the moment robust enough to capture ones who are affected, and also to see whether women do get tested at all or not. Maybe in a whole household is being tested, then you do have women and men and children, everybody get tested. But testing too is not very, very efficient at the moment. So what we really look at is the death figures in institutions. And that's the only thing that we have to go by at the moment. So I wouldn't want to comment on those, because I don't think those are total figures, neither do we know exactly comprehensively what is happening. But what we do see is that, like other situations of crisis, women are the ones who have to look after the household food pot. It's their responsibility. Whether they get access to food or not, it is their responsibility. And the men who are frustrated sitting at home, not being able to earn, a lot of the frustration gets sucked off to the women. And I'm sure, and when we come to some recommendation, I'm sure what is happening is that we are not getting real impact of who's controlling the household funds, what is happening to women in terms of violence. Are all those helplines that are meant to be for women's support, are they working? Are the shelters open and accessible? Because there is no way to record whether there's been a spike in domestic violence. Anecdotally, we know that it happens, because we've got enough evidence from our other not pandemics, but our crisis naturally. So I think important is to include women, number one, in decision making when we are talking about how women have to be involved and dealt with. We don't see women, as Wendy has very nicely told us, we don't see many women in the decision-making levels, except, of course, there are a few outstanding women who are going out and doing their bit. Secondly, I think it was a very good idea to be able to provide support, relief to the poorest. But the way it was distributed, as Abid has said, was really not the best way. In fact, we may end up increasing the pandemic and the spread of it. So there were instances where it was done in a very systematic and very methodical way. But I think we need to also recognize the lack of awareness and knowledge and information of the general citizenry. For the general citizenry, I don't think they've even comprehended the intensity and the seriousness of the epidemic. People don't seem to think that it is important. The level of literacy is so low in the country that people are not aware of what is an issue and what an infection can do. And in a way, we are lucky that we haven't seen deaths, but it is increasing. We haven't seen a decline in the incident. So I think there are many issues, and I will. I don't know if I have time now, but I would like to talk about the fact that the National Commission on the Status of Women and the Ministry of Human Rights have produced a policy paper and a brief on the impact on women and what needs to be done. I would really suggest that we look at that, and it looks at 6 sectors, 6 thematic sectors that need to be looked at, where we can't just be looking at women from gender-based violence. We have to look at the fact that a lot of the women are informal workers. Their source of income is gone. Their input into their household pot is gone. So we have to be looking at not only education and health, access to health, but labor force participation. We will need to look at the mobility issues and also the gender-based violence. So all those will have to be looked at. So when we come to recommendations, I have some specific recommendations on that. Thank you. I'll stop here.
Thank you very much, Ms. Khawar Mumtaz, for enriching today's discussion and joining us from Lahore. We would certainly like to listen to your recommendations. Perhaps when we go into the question and answer session, each one of you can give us a key policy message. We will now move to our next speaker, also from Lahore, Dr. Aisha Tareen. She is a clinical psychologist and works from Lahore as well as the UK. Aisha, what is the impact of COVID-19 pandemic on health, particularly that of women? And how can the psychological impact of the current crisis be mitigated? Over to you.
Assalamu alaikum, everybody. Thank you so much. I'd like to thank STPI and Usma for allowing me to join in this session, which I've really been looking forward to. Regarding the impact of the pandemic, I think it has been huge all over the world, both men and women. I know we're focusing primarily on the health of women, but it has had a huge impact worldwide on almost all individuals. The thing is that this impact is actually very complex and multifaceted, and due to the uncertainty that still exists about the progression of the disease, we still are not, I think, fully aware. Not all the effects and repercussions have still been anticipated, and we'll probably be coming up with new things and new effects as they arise. What I'd like to say is physical health is more visible. The effects on physical health of this pandemic is obviously more visible, not just in terms of the disease itself, but basically in terms of its consequences like quarantine, social isolation, lockdown. And I think there has been research on the effects of socialization, and it has been known that socialization in social isolation, not socialization, sorry, I'm saying the opposite thing. Social isolation basically has been found to be associated with increased rates of dementia, heart attack, and strokes. So there's still things that will be investigated, and as research comes up later, we'll find out other effects. Another thing that I'd like to point out is that health, of course, as probably all the panelists and your SDPI colleagues must be aware of already due to the nature of your own research. Health itself is linked to social and economic inequalities. For example, in Pakistan, malnutrition, which is currently obviously being exacerbated because of the loss of livelihoods, or in some cases inability to access food resources due to the current lockdown. I think because this malnutrition basically is being exacerbated, and then what happens is, like in Pakistan, in some communities, it is if there is a food shortage, then it is sometimes the male members are given more access to the resources than the female members. So obviously, again, this has an impact on the health of women and girls in the family. So basically, women are affected on many fronts. Also, another thing that happens is that in a crisis situation, in a disaster situation, resources are diverted from other health services. Say, for example, reproductive health services, in which, of course, women access this service more. But although women's health is affected in many levels, I would primarily, because of the nature of the work, I would like to focus more on their mental health and on their emotional well-being. I think women, being the primary caregivers, usually consider themselves as responsible for the health and safety of the household. And now, with all this fear of contagion, fear of infection, etc., I think the burden of domestic chores has really increased on women. And with this fear of contagion, I accept it is partly a realistic fear, but I think due to the information that has been going around, it has basically taken over some people's lives. And then this fear of contagion then has its own consequences in terms of leading to hypervigilance. I mean, people, when things are coming home, people are disinfecting them. They have elaborate routines for disinfection, not just of themselves, but of whatever comes into the house, whoever comes into the house. So this is also leading to quite a lot of stress in people. In terms of, first of all, they're hypervigilant, then it leads to worry, anxiety, in some cases, even panic attacks. So this is primarily because of their role in the home. Another thing that I'd like to point out is that this uncertainty that is going around and the fear of control, this is leading to mental health issues in terms of, again, worry, apprehension, anxiety. So it is all contributing at different levels. And I think with the reconstitution of households that has happened due to this lockdown, due to the reconstitution of households, women find their husbands at home, their children at home, and obviously that has changed a lot of the family dynamics. And women have to, after the initial so-called, I would say, the novel experience of people being at home together, I think both women have to deal with the anxieties and fears of their husbands and children. Also, with the children, they have to, some places are providing online education, others are not. And especially with younger children, they bear the burden of keeping them entertained. So I think that has also added a bit of pressure on them. Again, with the to point out that the impact is different for women who work outside the home and for homemakers, because those who work outside the home, the fact that they're being confined to their homes is actually a stressor in itself. So basically, it's a double whammy. They're having to stay at home, plus the domestic burden of household chores has increased. So I think that is also putting quite a lot of pressure on women. Again, I think children at home also, due to the, what can I say, the irritability of children and others, not just children, grown-up children are often those who are not at college or university. They've all basically, if hostels have been closed, they've moved back to the family household. So I think boredom and irritability and often angry outbursts, it's often the woman who is at the receiving end. And it is often the woman who is supposed to smooth things over and basically deal with other people's anxieties and fears, including that of her husband. And I think to a certain extent, Hawar Appa spoke about domestic violence. I think there has been actually a spike in domestic violence. Through my colleagues in the UK, the area where I work in Essex, the call centers have actually reported over 100% rise in calls to their hotlines. And I think the UN also has pointed out that there is a global surge in incidents of violence, for which I think the lockdown and quarantine are all contributing, because women are confined in their homes. First of all, if it's an abusive partner, then they are more at risk because there's no means of escape. I think for these women, the home can be the most terrifying place for them. And apart from that, even partners who are not abusive, because they're in this restrictive situation with their job uncertainties, the possibility of redundancy, actually, having been made redundant, I think, like one of the earlier panelists say, that can, of course, then lead to them venting out their anger and their frustration on their wives. She's a convenient person available to take that also. Another thing I think is that basically we're finding that for most families, this lockdown is like a readjustment period. Everybody is adjusting to this new situation, and for some it is proving to be more stressful than others and is definitely having an effect on their mental health. Another thing I'd like to say that is affecting women is in cases in which they are separate from their families. In some places, it can be because of travel restrictions. It could be because one family member has fallen ill and the others are now in quarantine or in isolation and not able to access that member. So there are two things here for the woman. Basically, she can have lost her source of support, which is all the more needed at this time. And also it could be that apart from the loss of support, the fear of them actually falling ill, actually being ill and basically getting this infection. So I think actually Lancet's, there's a well-known journal, The Lancet, and in February they did a review of 24 studies that basically looked at the effects of quarantine. Of course, this was for both men and women, but I think it's very interesting that basically they found for the psychological impact of quarantine, they found that what was very, very commonly found was low mood, irritability, angry outbursts, emotional exhaustion, panic attacks, anxiety, depression, the whole gamut of these mental health issues were arising there. So I think we really need to bear in mind that we're going to be looking at a kind of, people talk about a second epidemic. In most international protocols, what has happened since after the last few major disasters, what they're doing is they're doing a two-tent approach. So say one is dealing with the wounded, and in case here, the people who have actually got the infection, and the second is dealing with the people who are basically psychologically affected by the trauma. So we need to think of both aspects. And the second question that you asked, maybe we can go into a little bit more detail later as to what we can do, because that's a whole answer in itself. But I just want to point out that in the case of bereavement, which so many families are now going through, for women, I mean, and this applies to, I think, both the mental health of both men and women. I mean, bereavement, the loss of a loved one is a very painful situation. It's very painful in regular situations. It's just a very painful time. But here, the nature of the loss is different. It is so sudden and unexpected, and it can occur in a matter of days, a matter of weeks, and sometimes with no opportunity to say goodbye. Later on, maybe in some countries, we're finding not even the appropriate way, the customary way of mourning. So I think that is also having a huge effect on the mental health of people. And let's not forget, as Howard Appa also mentioned, the healthcare workers. It's having a huge impact of them. The majority of the proportion are women, nurses, midwives, and who are dealing day to day with these people. And I think their exposure to suffering and death and trauma is also something that we need to keep in mind. So basically, I think it's not just the trauma that they're exposed to. What happens is that the fear of catching infection themselves, and then the fear of when they go home, the fear of transmitting it to other family members. So when they go home, they also have to undergo a whole what should I say, a whole process of disinfection before they can meet other family members. So I think I'll just leave it at that for now, and things that we can do, maybe we can talk about later when we talk about recommendations.
Thank you, Aisha, for giving the details and pointing out the multiple dynamics of the whole situation. Indeed, it's a very difficult time for everybody the world over. So yes, in our discussion that will follow, maybe you can also suggest some ways how to cope with the situation in a better manner. So now I will move to Dr. Seema Pervez, who is joining us from Switzerland. And Dr. Seema, if I can ask you.
Yeah, hello. Assalamu alaikum.
Wa alaikum salam. We can hear you.
Yeah. Please. As I understand that this forum is discussing mainly about women, but as a student of psychology, I would like to talk more about the psychological impact on women. I really feel very proud and to avail this opportunity to express my thoughts and to convey how I feel these days. I myself going through a lockdown since last 1 month, and because of my age, and I know I am more vulnerable for the infection and this and that. So people are paying more attention and giving care to me that I should remain healthy and okay. So this is first thing that we should take care of old people very much, because these are the person who are more vulnerable during these circumstances. Well, this is very strange that those people who are luckily not directly influenced by the virus, they are not medically ill, they are making fuss of very minor things. For instance, oh, they are locked up, they don't have opportunity to socialize, they are not going to allowed to go out, the kids are problem, the toddlers are making life difficult. These are the very minor things, but they are not empathizing with the people who are really the sufferers. And this is a very rare situation in which all the countries, may it be the developing countries or the developed countries, rich or poor, anybody, they are equally in the crisis. So this is the time that we should try to look into the situation and forget the minor discomforts which people might be having, that they are not having the desired food or the desired source of entertainments. This is very strange that this time we are not thinking about the poor who are deprived of the very basic needs. And it's okay that in most of the countries, the professionals are busy in trying to find out the ways how to cure and how to control the disease. And because of course we know that the human life is basically much more important than anything. But as a psychology student, as a psychologist, I am more concerned about the secondaries of this disease, which I call the secondaries of this disease, is the whenever, inshallah, we will take care of the virus and we will finish it someday, sooner or later. Then these secondary impacts that will be on the mental health and on economy. These are the more long-term effects. They will affect the human life, the human race, our generation, the next generation, the coming generation. I don't know. The economy and psychological health, how much it will be deteriorated. But in this forum, I am supposed to talk mainly about the one sector which is more influenced and more affected by this lockdown, that is about the domestic violence. This is the area which in Pakistan is a taboo topic. We try to hide it. We don't want to talk about it. We want to brush it under the carpet because we feel that it is a basically for the family. It is a dishonor to talk about these issues. Whereas the fact is that the level of awareness about this domestic violence is just a tip of the iceberg. It is much more strong and much more aggravated problem in the society. So we should try to understand what is domestic violence, or especially since this forum is discussing about the women, I would like to focus myself on the marital relationship, the abuse in marital relationship. They are the persons who are more influenced. Unfortunately, in marital abuse, most of the time women is the victim. In certain cases, maybe there are men also a victim of the marital abuse, but generally in most of the cases, women is the victim in marital abuse. And when they are locked up, they are during the lockdown phase, they feel more vulnerable in relationship, both the parties, the abused ones and the abuser. They are feeling suffocated, claustrophobic, because the lockdown situation is trying to snatch their psychological space also. They are not having their own psychological space, and they feel that they are all the time they are too much indulging in themselves affairs. They don't have freedom to have their own space, their own activities, their own even reflect. They are not capable of reflect about themselves. So this type of ghutan and claustrophobic feeling forces them to feel frustrated, other than the real frustration in life, the financial, the salaries is not coming, the daily wages are not coming, the children are creating problems. These are the real facing problems. But the psychological problem is that they feel claustrophobic, and they are not capable of tolerating each other for the 24/7. So this is, in a way, this is not providing them the boundaries for the privacy, especially the ones who are living in small houses with extended families. They are not capable to protect their privacy, and once this privacy is broken, and then they feel free to practice the domestic violence. The domestic violence, which was previously contained to their bedroom only, now they can express during their daily life, chalte phirte, in their routine life, they express this. So this type of situation, I am afraid that will increase the domestic violence more. There is another aspect that whenever the victim, from the perspective of the victim I am talking about, that she feels that there is no way, because always she feels that if there is a domestic violence, I have a optional alternative. I can go to my friend, I can go to my parents, I can go run away, I'll leave the house, I will go away. These types of options are always in her mind. But when during this lockdown situation, she is not capable of even thinking, imagining these options. No matter she was exercising these options or not, but she was always confident that she has somebody there who will help her out. But now she feels very, very much confined and claustrophobic. So this situation is blocking all the venue of running away from the situation. Secondly, there is a phase, the during the post-violence phase, the victim tries to do some self-therapeutic activities. Sometimes it is impulsive shopping, sometimes it is gossip with the friends, sometimes she needs a shoulder to cry on. But during this situation, she is deprived of all these strategies also. She cannot think of going anywhere, so she is helpless. But still, there is one suggestion, or I can say, being a very optimistic person, I want to say a ray of hope in this lockdown also, that maybe there is a situation that she or both the party will have more time to spend together. If, since they don't have any other option in life, they think they have to live together for unlimited period. I don't know for how long. So they might go in better communication. I don't know. I hope so. Yeah, if they are not pathologically abusers. As a psychologist, I would like to classify the abusers. Some are pathologically abusers, and some are situational abusers. If those who are situational abusers, those have some ray of hope that during this lockdown period, they might have a chance to improve their relationship also, because they don't have anybody else, any other option to go out. They will have time to spend together. They will see how much the other partner is contributing in the household. They will realize the pains and pleasure of being in the house, the problems in the child rearing practices, the problem in the house making. So they will be able to understand each other. So there is just a positive hope that this lockdown has something in blessing in disguise, that we as a human being can be a better person, and our psychological health may improve from this perspective. But for that, as Uzma said, that at the end of the session, we will try to do some recommendation. I have some suggestions in mind, which, if possible, suggestions are always very idealistic, but I will try to see some realistic suggestions to improve the situation. But for me, the disease will be, inshallah, controlled. But these which I have coined this term, secondaries of this disease, are very dangerous, which are basically economic and psychological impact of the coronavirus. Okay, for the time being, I'll stop here. Thank you.
Thank you, Dr. Seema, for adding to the discussion and raising some very important points here. So our next speaker, Ms. Sadia Bukhari, has joined us from Islamabad, and she will be talking about post-COVID-19 situation. When the crisis abates, what steps should be taken for intersectoral development with a focus on gender equality? Over to you, Sadia.
Thank you. I'm really obliged that I've been given this opportunity to share my thoughts with all of you. And I would like to point out towards what is happening with reference to Pakistan. And the small and medium enterprise, they are not being able to function, and the government is not being able to do much to support them. And in this situation, I feel that we need to look at options, because our country cannot sustain for really very long if we continue with the lockdown. So I have been reading up on the web about how different countries are dealing with it. And for me, the example of Japan is very interesting, and I think that we need to look at that as a model. And in Japan, most of the cities have not been put in the lockdown. They continue with their work and whatever it is that they're doing, but they have certain habits which are deeply ingrained in their culture. Like they leave their shoes outside the house when they have to come in, and children, if they are not well, if they are suffering from flu, they will wear a mask, as well as adults. So I think that keeping COVID-19, the threat perception of the pandemic in mind, I think we need to educate women, especially, and the general public, of course, about things that we need to adopt as a way of lifestyle so that we can continue working even during the pandemic, because uh, as you all know, it is not we will not be able to sustain, our SMEs will not be able to sustain if the lockdown continues indefinitely. So this was one point that I wanted to put on the table for discussion. And the number two point, because I work with the Human Rights Commission of Pakistan, and I'm on the Council of Human Rights Commission of Pakistan. One a very painful thing is that some women have reached out who are under threat of domestic violence, and we have tried to act in a supportive manner for them. We have spoken to them, we have given them counseling, and we have told them what to do, what not to do if their spouse becomes too belligerent. And we've also provided them numbers which they can call the police if the situation gets out of hand. And because I've been on phone with these women, and I've been requesting them to devise ways and means where they can escape this kind of violence. The second point that I want to make is that we need to have comprehensive programs for disseminating information, for do's and don'ts for women, for conflict resolution. They should be taught that when they're in a conflict situation, what are the techniques that will make them be in a comparatively safer environment. So these are the two points that I wanted to put in front of all of you. And when I talk about intersectoral development initiative once the pandemic is off, I think that we need to have a comprehensive communication strategy for every sector of life, and we should be able to give them tips on how to maintain their mental as well as physical health, because small issues, small do's and don'ts, they read about them in the newspaper. We all know what is happening. We all know we need to wash our hands. We all know that we should not bring our shoes inside the house, or if we have gone outside, when we come in, we should change our clothes and wear a new set of clothes. But I still think that a more comprehensive education, needs to be disseminated. Thank you.
Thank you, Sadia, for joining us from Islamabad and suggesting a way forward after this crisis ends. Next, I would like to request Ms. Saman Ehsan, joining us from the UN Women Pakistan, to share the key highlights of the recently launched UN Women's Report with the Ministry of Human Rights on gendered impact and implications on COVID-19 in Pakistan. In this regard, we would also like to hear from you UN Women's priority areas in these times of crisis. How will COVID-19 pandemic affect the realization of the SDGs in the decade of action? And is there any data that UN Women has collected with regard to women's livelihoods lost in the current pandemic? So over to you, Saman. Thank you.
Sorry, this is the first time I'm using GoToMeeting, so I was figuring out how to unmute myself. Thank you so much, SDPI, for inviting me to this panel, and I'm really honored to be among such distinguished panelists. And Havar Appa is, of course, my own personal role model and a source of inspiration. So I'm just delighted to see her and be on the same panel with her. It's a big honor for me, as well as all the other distinguished panelists. So let me start with COVID-19 and what it is going to do to the whole world, and especially as you mentioned the SDGs. How is it going to affect progress towards the SDGs? Definitely, it will affect the progress, and it has the potential to throw the whole world back significantly in our progress. As you know, it's been characterized as a pandemic by WHO, and it's a global health crisis that's unprecedented in recent history, at least, the history that I remember or most people remember, and definitely the 75-year history of the United Nations. But it's much more than a health crisis. It's a human, economic, and social crisis, and some aspects of these have been covered by the other distinguished speakers. It's going to affect all segments of our population, and it's going to be particularly detrimental to members of groups who are in most vulnerable situations. And if not addressed properly, it can really slow down our progress, increase inequality, exclusion, discrimination, global unemployment, and have impacts in the short and medium and long term. In the short term, we will see increased impact on women and other marginalized communities. Their livelihoods are being impacted. They are facing health issues, including mental health, which was really described very well by the our other panelists. And the care burden on them is also increasing. And of course, incidents of gender-based violence are also projected to increase. Already the situation in Pakistan is that around 1/3 of women do face violence since the age of 15, and a large number of ever married women also experience spousal violence. So as my colleague has earlier said, that evidences from previous epidemics show that the stress in coping with them increases the risk of domestic abuse and other forms of violence. Unemployment tends to increase depression, aggression, violent behavior. And also in these situations, women are often stuck at home and they don't have access to the same resources, supports that they would have in a normal situation. So in the short term, it's going to have this effect on women facing increased vulnerabilities and less access to support. In the longer run, COVID-19 will affect progress on SDG targets because governments and other development actors are now focusing their attention to tackle this new crisis of unprecedented level. So as I said before, poverty, inequality, unemployment will increase. It will drain the resources of the governments. It will affect our infrastructure. So it has the potential to really throw us back quite a lot. But I think we can also see that the crisis situation can be taken as an opportunity for the world to change the way we do things. We need to realize how important comprehensive universal social protection systems are for providing basic income security at all times, for protecting people, especially the vulnerable people, and reducing poverty, enhancing people's capacity to manage and overcome shocks. This is not just about rectifying inequalities, but building a more just and resilient world. And here I'd like to quote from Kani Wignaraja, who is UN's Assistant Secretary General and Director of the UNDP Regional Bureau for Asia Pacific, who said that a key issue is whether the world returns to the old normal, which places many countries on a path that is not compatible with attaining several SDGs, or on a new normal that holds on to the adjusted practices that are good for sustainable development. So I think a lot of work is being done in response to the COVID situation, and perhaps we can change the way we do things so that post-COVID, we have structures, mechanisms, supports in place that support the most vulnerable, marginalized, and bring them up and help us achieve the SDG targets. With regard to question on data, now data is quite a challenge in Pakistan. In normal circumstances, we don't have consistent, reliable national level data, especially on women-related issues and gender-based violence. But this is a extremely difficult situation. We're in a crisis situation. Movement is restricted, so data collection is quite difficult in this. And as yet, there is no thorough and comprehensive data on the topic But UN Women has undertaken a survey. The results are not out yet. The survey was sent through mobile operators to a large number of people, including rural populations and women. So we're waiting for the results to come out, and we will analyze that and share that once it's out. But if you look at the situation, I mean, whatever data we have, it points out that COVID-19 is not just a global public health emergency, but it is leading the world to a major global economic downturn, and especially it can have strong impacts on the livelihoods of vulnerable groups. In a country like Pakistan, where our socio-economic developments are already very low, an epidemic is likely to compound the gender inequalities and other kinds of inequalities and impact the livelihoods of women.
We've
Around
lost
20%
you,
of
Saman.
women in Pakistan are currently involved in income-generating activities, and most of them are in the informal sector. Most are, likely to be unemployed. They are likely to have lose their livelihoods and face economic vulnerability. I think we agreed to come to the recommendations later on. So now I'll just share what UN Women is doing at the moment. UN Women, it's our mandate to support the state departments, the government institutions, and other partners on applying a gender lens on all interventions. So we are continuing to do that work to make sure that special focus is given to the needs of women and girls, as well as other vulnerable groups, such as the transgender community, women with disability, women from hard-to-reach communities in these unusual circumstances. We're playing a partnership role with the key government agencies who are working on the COVID response actions and supporting them to integrate a gender lens. UN Women is also playing a very important coordinating role on gender issues. So that's part of our regular mandate in countries in the development setting. But it becomes even more important in the humanitarian setting, and we're working with the government partners, UN agencies, other development actors. An important meeting that we held earlier this month was the Interprovincial Ministerial Group meeting of the National Commission on Status of Women, bringing together representatives from the Ministry of Human Rights and provincial women development departments and women commissions for obtaining their inputs on the situation and also their policy recommendations. We're also developing advocacy messages for different groups, like the Donor Coordination Group on Gender, the UN Gender Theme Group with civil society organizations and networks. And as I said, data collection has been an issue, so we're trying our best to support this. And we did an assessment of the impact of COVID-19 on women in Pakistan as part of a regional survey. We also worked on a socio-economic impact assessment of COVID-19 through a gender lens to provide evidence from secondary data on the gender inequalities. And we developed the brief with collaboration of the Ministry of Human Rights and the National Commission on Status of Women with the policy recommendations. We're also going to be doing data collection and trend analysis from service providers such as helplines, quarantine centers, to get a picture of the situation of women in the current crisis. And as I just mentioned, helplines, we're supporting agencies that are providing services to women and girls to be more responsive and effective in this crisis situation, like shelters, helplines, law enforcement agencies, prisons, and other structures that are being established in response to the situation, such as quarantine centers. We've worked closely with the NDMA and PDMA, and in KP, we've already supported the PDMA develop SOPs for the quarantine centers to make sure that they respond to women's needs and issues and are overall keep in mind safeguarding principles so that no additional harm is done. Apart from that, another important activity that we do is awareness raising and dissemination of messages on COVID. And again, we are doing this with our different partners, because I think the more these messages go out, the better it is, especially messages on how COVID-19 is affecting women and what are the resources and supports that are available to them. So that's, I think I covered the major points. I'll go to the recommendations later on.
Thank you, Saman, for joining us and sharing the key points from the UN Women's perspective. So before I open the floor for question and answer session, shall we go back to the panelists and hear one to two key recommendation or a policy guideline that you can share with us. So can we start with Your Excellency Wendy Gilmore?
Yeah, absolutely. Thank you very much, and fascinating discussion. I took the advice to turn my webcam off to try and improve quality, so I was still here the whole way along. I guess I'm fascinated at the breadth of issues that are raised by this particular crisis, and from the psychological aspects to the social aspects to the roles that women play in this society and the type of interventions that are available. It is, we keep saying, I think it's truly unprecedented. It's really, truly unprecedented. So I would go back to sort of my suggestion. I guess my practical suggestion is starting with, in a Pakistan context, how do we ensure that gender-based analysis, gender issues are included in decision-making? And that's either through advocacy or trying to support there being effective and diverse representation at decision-making tables. And that's something which is challenging in a society where we don't see a lot of women in very senior positions. There are a few and some very effective ones, but not as many as we would like. The other thing that I would take away is for Canada as a donor, for our colleagues in the donor community, for the UN agencies, is to ensure that some of the really good programming that we have been engaged in over time is not, and I wouldn't say diverted, because the needs are enormous and there will have to be a reprioritization of some programming, but that we ensure that we are continuing space for the type of gender advocacy and support for women and girls that we've been doing normally, but that we see that reflected in current programming, in current priorities. It's often very easy for the urgent to push the good ideas out of the way. And I think it's important for all of us in my own programming, in my own country's donor activities, to ensure that we maintain a focus on ensuring that that we have the right type of advocacy for gender issues included in this overall picture. I would stop there for the moment.
Thank you, Your Excellency. Savarapa, can I request you for a key recommendation?
Certainly, we've had a very good set of presentations and aspects of the issue and its impact. I just want to, I think there are two kinds of recommendations we need. One is immediate, to deal with the issues as they crop up, and we've seen some immediate response, some successful, some not so successful. And the other one is a longer term, because we are talking about poverty, inequality, lack of justice, and that is more of a long-term socio-economic reform that we need to do. For the immediate, I think what is very important as a first step, someone is here from UN Women, I think this is a good opportunity. The policy paper and brief that has been developed by the Ministry of Human Rights, NCSW, and through consultation with the UN Women, I would suggest it should be translated into Urdu. And then the 6 thematic areas that you have identified where attention is required, they should be sent to those departments, those ministries at the central level, federal level, and the provincial level. Those are issues that should go in local language in Urdu, so that people can actually apply what is being suggested. We have very good policies. We don't know what happens to them when they get implemented. So we need some system of where good recommendations go down to the level where they can be implemented. And if they are sent through relevant ministries, there are 6 sections that you have. You have education, health, labor force, financial empowerment, gender-based violence. All those can go to those particular sectors and would be effective, and if it is done fast. So that is one of the most immediate. Secondly, something which will have a long-term implication is towards data. We have to register our informal workers, the home-based workers, the domestic workers, so that we know when there's a crisis who is in need of actual support. Not only those who are the ultra poor, but there are others between the ultra poor and the lowest middle class who need support. So I think we need registration. There are laws in Punjab and Sindh at least to register informal workers. We need to implement those for longer term, for future, for women's empowerment as a whole. So I think a couple of those things we need to do immediately. Thirdly, I think what we tend not to do, again, longer term implication is that we do not use school teachers and students to advocate and to to take forward recommendations, good knowledge, good information. Why is it that at the local level you go to the mosque to take guidance and not to the school teacher to take guidance on these issues? I mean, I think this could be built into our system, that what happens when there's a crisis? What should the teacher be able to communicate to the children? Children can be much more effective and pushing on new ideas than elderly men in a family. So I think we need to be looking at it in, in different ways of mobilizing people who can have impact. The fact that nobody thinks isolation is an important thing, culturally it's not. How do you give people the importance of something as dangerous as COVID? One more thing before I mean, since you've asked only for minimal, I'm not going into the details. The third thing is that obviously our services don't function. This is a breakdown of our health infrastructure, its operations. And I think we need to look at why do our services don't work, and why don't we have our local governments in place where local level male and female leadership could be mobilized. We've seen when there were local government in place, a lot of immediate relief was easily possible. So those are the things that we need in terms of institutional and structural systems. Finally, I just wanted to share an interesting data that has just come in front of me, where we see that in Pakistan, younger people, there are more cases of young people getting COVID-19, but deaths are of that particular elderly age. More deaths of men and than females, but very interesting, between the age of 70 and 80, no women's death is recorded for COVID, which is also interesting. So my final point is that SDPI is there and the other research institutions. This is the time to do some in-depth research on some of these issues. What happened in one community at the university level or at the UN, women could sponsor not an in-depth analysis and understanding of what the dynamics are. So we do need more studies, and this is the time to do it. Why is it that in a community, actual survey of how many people got ill, it can be done, researchers know how to do it, but we do need more studies to be able to understand dynamics, which we then address meeting our SDGs. SDG 5 is all important, and all the resources are going to be diverted to a whole range of things, and women are not going to be benefiting. And I think we need to focus on that, not only the gender lens, but actual gender involvement. Thank you.
Thank you, Khabar. Before I request the other speakers to share their recommendations, can I also request the audience to post their questions in the chat box on the right side. Please make your questions concise and clear. Can I request Dr. Aisha Tareem to share her key recommendations? Thank you.
Just a quick question myself. Before I go on to recommendations, is it possible, if there's time, that I can take 5 minutes and just talk in very general terms about, like, at a micro level, at things that women, well, both men and women, we all can do just to kind of promote our own emotional well-being at this time? Or do we not have time? Do we have time?
If you can make it in the next 3 or 4 minutes, I'm sure the audience is also waiting to ask questions, and I can see some questions popping up in the chat box.
Okay.
Go ahead, Aisha.
Okay, I'll be very brief. Just the simple common sense advice that is going around. Basically, take care of yourself. I know this seems a bit facetious and it's a bit problematic when we talk about women and people belonging to disadvantaged and marginalized communities. But for the majority of people who can, I would say it's important in this situation to really pay attention to yourself and take care of yourself, because any of our family members can be effective and we can be affected. And to be effective caregivers, I think we need to pay some attention to ourselves. So I would say to everybody, just take care and be kind of yourself. And what does this involve? Very simply, it involves having a balanced diet, plenty of rest, sleep, and everything that all these things that are going around in the media. But I think what is very important for us is a kind of a media detox. We need to have because we are bombarded with all these messages. I mean, people are also calling this an infodemic because there's just so much information going around, a lot of which can be false also. So we need to really look at where the facts are coming from. I think that is also creating really health issues for people, because it's very difficult to filter out what is actually fact and what is just being spread in the media from whatever unreliable sources. So if we can, I think apart from that, if we can take a little bit of time, we just allocate some time when we look at the media, listen to television, papers, and otherwise allow some time when we just get away from the media. And another thing I think which is very important is setting up family connections. I know most people know about this, but I think to develop this kind of relationship that it's the importance of hearing another human voice at the end of the line. So I know we send WhatsApp messages, we send emails, but it's really important to just hear another person's voice. Like it's great what we're doing today, maybe just a video call to somebody who you haven't spoken to for a long time, who you know might be elderly, have not had the chance to speak to people, maybe or may not be in isolation. I think setting up these connections is really important, because social distancing doesn't need to mean social isolation. It depends on how we behave in it. And I think the other thing, I think these are the main things, what we can do for others. If we offer support to others, that actually promotes our own emotional well-being. So whatever our motives, if we go searching for others, can we help them in some way? Can we help our neighbors? Can we talk to them? Can we buy their groceries, etc., etc.? There are so many ways in which we can help other people. And in helping them, actually, we are helping ourselves. And finally, I would just like to say my last point was basically that there's certain things which people tend to laugh off as alternative things, but I think from the point of promoting emotional well-being, they can be quite helpful. Mindfulness, meditation, things like relaxation exercises, all these kind of things. I think hobbies, I think many people have already started reading, music, etc. All these things that divert our attention, because we are witnessing a human tragedy of immense proportions, and it's very difficult not to be affected by the news that we hear. But we just need to keep a little bit of balance and perspective, and just remember what we can do and what we can't do, because humanity has suffered from pandemics before. This is not going to be the last one, but we just need to know that humanity just does survive. A lot of people, of course, perish, but I think we need to focus on survival and taking whatever else we can out of it. And shall I go to the recommendation now quickly?
Okay, quickly.
Quickly, yes. Okay, I think I'm again going to talk primarily from the view of mental health. I think if we can set up some crisis counseling support services for those directly affected, the good news is that is starting. Telemedicine centers have already been set up. And I think a mental health telemedicine center has actually been inaugurated yesterday. I just saw it in the news today, and I was so happy to hear that. It's based at Government College. Also, I think basically at the broader level, what we need to do is integrate physical and mental health services, excuse me, because we tend to ignore mental health. Like, it's not that visible, okay, forget it. There's a lot of stigma attached also. So I think if we can think of mental health as part of a public health response, that will be very helpful. Also, we can do outreach work to promote resilience, and also let people know where to go and how to get about seeking help. I think I've read so many things in the newspapers that people have been wandering from one place to the other, not knowing where to go, how to seek help. I think that kind of dissemination of information, like your other speakers have talked about, I think that would be very helpful. Last but not least, public education. I think that is also very important, and this is in terms of the future also. I think challenges around mental health basically require concerted efforts from civil society, policy makers, and healthcare professionals. But public education, that's how we can change attitudes, that's how we can reduce the stigma. And the things that people are facing, anxiety, depression, it is through that we can tell them that this is normal, this is an understandable reaction, and give them some advice as to how to deal with it. Sorry for rushing through it.
Thank you, Aisha. Dr. Seema, can I request you to give some recommendations?
Okay, thank you very much. I would like to keep myself very brief And because in general, I will be carried away to give so many advices to be positive, and as a psychologist to give so many advices for improving the mental health. But here, as I was given the topic of domestic violence, only talk to on about domestic violence. I would like, as Khabar Mumtaz Sahaba said, that some long-term and some short-term recommendations. For the long-term recommendation, of course, the main thing is that we should try to implement the slogan, break the silence. The domestic violence is an issue on which we never talk about. We hardly talk about it, and we feel very shy accepting that we are going through some domestic violence. So we should try to create this atmosphere that at least there should be some person who you can share it, and she or he can communicate it to a larger audience. So on research papers, on research reports, we find that there are X% of women going through domestic violence. But in reality, everybody will say, no, I am not going through it, but one of my friend is going through it. So this is a very strong stigma. So I don't know. The victim is more apologetic than the abuser. The person who is being abused is more apologetic about the problem rather than the person who is the person who is inflicting the violence. So we should try to change this, but of course it will come not in a day or two. It may take decades. So it's a very, very long-term recommendation. But here today in this situation, though I am not very much aware of the present situation, ground reality in Pakistan, what are the resources available, but I understand that there are very few places where abused women especially can approach. So there should be some way, we should provide some breathing space during this phase of confinement, during this phase of lockdown. We should provide them some space to go out. And because for girls, for women who were in the house, the easiest way was that we are going for shopping, we are going for grocery, or we are going to pick and drop children to school. So all these are prohibited these days. So we should think the NGOs or the policy makers or the resourceful persons should try to think some way that these women who are just confined to houses, they should have some breathing space and should go out. One thing which is just coming randomly in my mind is that these days the school buildings are empty, they are underutilized, the teachers are available. So is it possible that at any level these teachers are asked to call parents in small groups, keeping an eye on social distancing and providing them some opportunity, an hour or so, to have some tea together, to chit chat, or just for improving their mental health. And in the meantime, if there is some victim of domestic violence, at least she will be able to talk to somebody. She will be able to have some ray of hope that there is somebody who can listen to me. So this is my, just I was thinking last night, okay, how can we implement this situation? So the best thing I can understand that as Khawar Mumtaz Sahiba also said that these are the teachers, the schools, these are the educated section of our society. Why we are underutilize them? Why we are not using them to empower the masses, to use them to communicate through children? But these days, of course, we are not trying to involve children in this issue. But I was thinking we can create some club sort of thing, women club, in which in a group of 10 or group of 6 they can be called, or in schools in different classrooms they sit, and not exactly the adult education, but they can have some leisure time, some board games or some this type of leisure activities. So this is why understanding that, because this confusion, this suffocation is will be enhancing their mental health and their relationship in the family, and all the time having burden of the household. Of course, when the women are in house, the household tasks are also increased because everybody is at home, everybody is demanding, everybody is not in our Pakistani culture. The house, all the members of the household house are not taking equal part in the household chores. So it is too much burden on the lady of the house. So she should have some respite. She should have some opportunity to go out and have so-called fun. So the maximum fun she can have is that meet some friends and have some small gathering and have a cup of tea with them or so. So this is my humble request that some NGO resourceful organizations can think over it if possible. Okay.
Thank you, Dr. Seema. Can I now request Sadia, followed by someone to give quick key recommendations, and then kindly also have a look at the chat box. There's few questions are have been posted for you to answer.
My recommendation is that I think we need to have a comprehensive communication strategy to address issues of gender-based violence that are being faced by gender communities. And for this, we can use radio, television. Like there is a question in the chat box that uh, can't they, like they have television for children, education will be a tele education channel has been opened by the government of Pakistan. Similarly, tele education channel to address gender issues can also be opened by the government of Pakistan. So these type of initiatives, which are absolutely essential in times like these, have to be undertaken. Thank you.
Thank you, Sadia. Over to you, Saman.
Thank you, Ji. I think a lot of good recommendations have already come up. I'd like to add that we really need to understand the needs of the women. And as Dr. Seema said, you know, they have a need for recreation, they have a need to improve their mental health and de-stress. So their situation and the challenges they face have been exacerbated by the situation. The extra burden of care, the mental health, being more at risk of gender-based violence with less access to support and services. So in this situation, it's important to increase access to information and services, make sure that there is continuation of health related services, and especially gender based violence response services need to continue and even scale up. They should be considered an essential service. um, Movement restrictions during the pandemic require adapted solutions for gender based violence service provision. So we should look at innovative ways to promote technology based support. And at this point, I'd like to answer somewhat Nazima's question on the safest ways for referral mechanisms by victims who are facing GBV at homes in remote areas during COVID situation. So one initiative that we are supporting at the moment is the Ministry of Human Rights National Helpline. It's currently a telephone-based helpline, but it's national level, and we are looking on how it can be enhanced to support women who are survivors in this situation, because it is possible that a woman who is locked inside her home and her husband is the person who is abusing her, she's not able to call, she's not able to speak on the phone. So we're looking at, technologies whereby she can either press a button, call a number, and then press a button that enables her to reach the support, or send a text message, or other innovative, like there are certain apps that also have emergency buttons. So we're working closely with the Ministry of Human Rights to upgrade their current helpline and make it available through a different kinds of channels, not just phone helpline. And so it's a national level helpline, but in addition to that, there are different helplines at the provincial level also, and I think there are helplines in each province which are providing different kinds of services that can be reached out to. In addition to this, people who are providing services need to be trained on gender issues, on the risks and the vulnerabilities that women face, and on gender-based violence, and be trained to respond to them. So we need to look at the well-being of women and girls holistically. The physical, emotional, economic, all of these go hand in hand. That's at one level. And at a macro level, the whole range of policies that are being developed, the interventions that are being planned, they need to be designed and implemented with a gender lens. And this was also mentioned earlier by Her Excellency Wendy Gilmore, that a gender lens needs to be applied. And we need to remove the barriers that prevent full involvement of women in educational, professional development, and economic activities. We need to ensure provision of equal pay and equal opportunities, social protection schemes, financing for women and entrepreneurs, and mechanisms to promote self-employment. This is for the long term. This is something we can do now and keep going, so that in the long term we can have a more just, equitable country, and we can work towards achieving the SDGs. One last but very quick point is that we need to engage women at all levels of planning, all levels of decision making. So all the committees, all the services providers, they need to have women at the top level of decision making, and also at the technical level providing the input. That's really important. We can't plan and roll out interventions that do not engage women. Those are my recommendations. Thank you very much.
Thank you, Saman. There's a question from Dr. Imran Khalid in the chat box, if any of our esteemed panelists would like to answer it. The government of Pakistan has launched a tele-education channel recently. Can a similar initiative for COVID and beyond be taken to reach out to women across the social spectrum in Pakistan and in their local languages? What would such an initiative entail? Can any one of you would like to answer it? Thank you.
As I had suggested earlier, we need a channel which should address attitudinal change. It should address techniques for conflict resolution, self-preservation, and as suggested, other activities like leisure and maybe creating a women's club. These are the key needs right now. Thank you.
Thank you, Sazia. Ji, please go ahead.
I just wanted to say that, there is a national TV, there's a national radio system, there are your, fast, the local radio services, which are being used, but they're obviously not being effective enough. And I do think that we need structures that take these things forward. Not an NGO comes and does it in their area. That's not enough. The various people can give you the technical advice, but a program to become effective has to be owned by the government, whether it's the provincial government or the federal government. So I think it is possible. It has to be then taken charge of, and inputs can be received from all kinds of people, from different technical support, local workers, special expertise. But the ownership has to come from within the system.
Thank you, Khabarapa. There's another question also related to media from Aisha Kesarani. Can the media be encouraged to show household burden sharing during quarantine time and their stay-home awareness campaigns? Would any of you like to please answer this question? Thank you.
Yes, I think this is a very good idea, and this will be, but what will be the strategy? How would they like to interview the women involved in the household work, or they want to make some documentary, or what type of thing she's thinking about? But that this is a great idea, that in this way the women will feel some importance, and they will think that their contribution is being acknowledged. So it will help in increasing their self-esteem also. But there is a little danger in that this should not become an acceptable norm. And that should be presented in that way, that burden of the household task is not only the responsibility of women. When it is a lockdown phase especially, and all the people are at home, so the household chore should be equally shared. So if the program is made in that way, that it is propagating the equal distribution of tasks, equal distribution of effort of carrying the household works, then it's okay. But if it is just to show off the mazlumiyat of a woman, that she is working so much hard and she is so pressed with the household work, then I think it will again propagate the bichari image of women, which I won't like to do that.
Okay. Another suggestion is that we can, design programs with, where men come forward and they talk about how they are helping the women in their family, what kind of supportive role they are playing, and this way, we don't need to really challenge the gender norms, but it will be a very positive way of bringing forward. Because a lot of messages that I've been looking at in social media, men tend to, there are a lot of memes and TikToks that are making fun of being at home with the wife. So, that kind of content that is being generated, that can be addressed as well. We can have media content that would promote the positive gender norms that are there in the society. Thank you.
Now, I think we should conclude this session. It has been a wonderful discussion today. With this, may I request Dr. Waqar Ahmed, our Joint Executive Director, to give the concluding remarks and take home key policy messages from the discussion today. Thank you, Dr. Waqar. Over to you.
Thank you, Uzma. And I thought of speaking when you had invited the male members, but then I sort of stopped myself that perhaps it would be best to come in at the last to thank all of you. So, so not only to yourself, I think I owe a big thanks to all our resource persons who have joined us today, all the participants who joined us. I'm looking at the chat box as well. This has been a very rich discussion, and I think it is now for our team to sort of package the policy recommendations in the most succinct manner and do justice with the kind of discussion, rich discussion we have had today. I think maybe, and this is just as closing a couple of points to sort of not with the objective to summarize, but just with the objective of probably emphasizing. And I think we, as researchers, probably need to be sort of humble in accepting that we still do not have complete information at the moment. The scientific facts are changing, evolving so fast, and probably this is why taking a real-time assessment of pressures on women becomes so important. And of course, we are talking about women in some very diverse settings. So it is important to sort of take a holistic view with the objective of leave no one behind agenda, as we call it. Now, we also understand that some of these recommendations from today can go to our focal persons at the EHSAS program office, who have been doing some excellent work and are very open to suggestions. We have been engaging with them in the past online dialogues that we've had for over the 2 weeks. And that's where probably I think the gender lens in EHSAS interventions, while it is there, but of course the room for improvement, which we have noted today, needs to be communicated. I think there was a very important suggestion, which again we need to sort of communicate to not only the Planning Commission, but also the provincial planning departments, which was about the PC1 process and the very fact that development budget at the federal level, at the provincial level, needs to have gender-based considerations, as the High Commissioner also noted. And I think the timing of this recommendation is very right, because we are almost a month and a half away from the finalization of next year's federal budget, which of course is being prepared under some very constrained circumstances. But the Ministry of Finance remains very open to such suggestions, and of course Planning Commission also has a role when it comes to development budget a month and a half later. So this is probably the right time to communicate this very basic fact that any current or post-COVID PC1 that comes their way should have very clear gender-based considerations, which can be monitored, evaluated, and learning can be drawn from them. I've also taken note of the fact that when it comes to meetings, particularly in the policy circles, and this is something which we've been raising, the participation of women has been weak. And I give the example of Economic Coordination Committee, which actually is now meeting every week, responding to the cash and in-kind needs of the vulnerable population. However, the ECC rarely has participation from the women or the women cabinet members, something which we will be raising as part of our recommendations. I think we received some very input when it came to the women in business, self-employment, women in agriculture. And this is a very important point which we need to stress upon. And we will also take it forward on our Facebook Live program, which we are doing with the provincial governments on the 17th of April at 7:30 p.m. Most of the provincial government representatives will also be there, who are involved in their chief ministers' focal offices for COVID response. And I think we sort of need to sensitize that women in business would require much more facilitation as much as we are currently envisaging, compared to what we are currently envisaging. In the morning, I did receive a central bank communique which noted that despite of a liberal interest rate regime now in the face of COVID, still women borrowers are not getting or access remains a problem for women borrowers, something which STPI team will be looking into in the next 2 days. And of course, it is these women-led businesses, some of them may be at a startup stage, some of them may be at a scale-up stage, that need immediate help from the Central Bank and Pakistan Banks Association. There were some very good advice regarding innovations that need to take place. And I think an inventory of this must be circulated once the policy recommendations document goes out to this group. We do have a social innovations team which has tried to come up with an inventory of how online innovations are helping home care, child care responsibility, even counseling, which was suggested by two of our speakers. So just having an inventory of these online innovations would be sort of important for this document, so that these can be replicated in other parts of the world, in Pakistan, of course, being the priority. Maybe I like to sort of just close in, and this is the last part of my intervention, on what is it that that our community, which is the think tank community, what lessons do we draw from today's discussion? I think what we have noted from today's discussion and what we are hearing from our colleagues in the government is that they are in a firefighting mode. So essentially, the traditional ways of doing research and advocacy and then communicating to them needs to sort of evolve in a very quick manner. And it is probably action research which they are requiring, sustained interactivity which they are requiring, given that scientific facts are changing very fast. They are requiring policy adaptability, within which, of course, given the kind of criticism and feedback the governments around the world are facing, they can only work with this sort of feedback or constructive criticism if only adaptive management is available. So I think these 3 points, which would be a stronger movement towards action research, sustained interactivity, and policy adaptability, are probably 3 things which policy think tanks would have to really adopt quickly, and in order to change their ways they work with the public sector, and help the public sector better in going forward. I think in one of the very recent dialogues with the Federal Minister for Science and Technology, we did note the lack of health sector think tanks in the country. While universities continue to do very good work, but we don't have good policy think tanks on health, something which we need to take forward if the advice of this group on several innovations like telemedicine or mental wellness innovations have to be taken forward in a systematic manner. I'm grateful to you, Uzma, for hosting this discussion today. Also grateful to Aisha and the STPI team for organizing this. And of course, once again, very grateful to the panelists and the guests who have joined us today. Thank you.
Thank you, everybody. Thank you to our esteemed panelists and the audience who have specially taken out time today to be in this discussion. Kindly also have a look at our journal sometime. I have posted the link in the chat box. SDPI journal has been recognized in the Y category, and you're welcome to submit your scholarly papers for this journal during this year. Thank you for joining us, and have a pleasant evening, everybody.